about 2 weeks ago, her owners noticed that she had this spot, this scab on the back of her neck. And at first it looked like just a scab, if you want to come in and get a close-up of this. But then they brought her in and we did what's called the cytology. We put a needle in there, sucked out some cells, and looked at them under the microscope, and it turns out this is a skin cancer. It's a skin cancer that's fairly common in dogs. It's called a mast cell tumor. And it is a common skin cancer in dogs, but even more so in what we call the brachycephalic dogs, or little mush-nosed dogs like boxers, Bostons, pugs, have a higher risk of skin cancer than other breeds. Boxers probably more than any other ones. So what we're going to do today, we're going to show you a picture of what the slide looks like under the microscope. But today she's come in to have surgery to have this removed. So right now we're going to do a pre-surgical exam. We're going to listen to her heart and lungs. Then we're going to get a current read on her, put an IV catheter in her, and then get her medication, her pre-surgical medication. But we'll take you through those steps as we take her into surgery. Now this is a fairly small lump. It's about this big. But because of the type of tumor it is, she'll end up with a incision on the lump about this big, because we want to make sure we get good, clean margins so that we're less likely to have a cancer that's going to come back. When your dog has a lump or bump on them, usually 90% of those lumps and bumps are benign. But the reason we're doing cytology is we want to make sure we pick up this 10% that are cancers before they become more of a problem. So that's why no matter what you see, we want to check when your dog has a lump or bump that you can either feel under the skin or see on the skin like that. So I'm going to listen to her heart and lungs, look her over, and then after that we're going to go through the next steps of how we're going to prepare her for surgery. It's going to make sure you're not anemic, make sure your kidneys and liver are doing well. All right, so listen to your heart and lungs. Yeah, oh girly girl.
No, baby, thank you. It's all done.
Let's feel your tummy. And we have also a filter all over to make sure that there are no other lumps or bumps that we need to be taken off while we have her under anesthesia. Zoe says the worst thing that's happened to her so far today is that she's missed breakfast and she can't believe everybody forgot to feed her. But in preparation for surgery, she does have to not eat anything after midnight. She can have she had water all night, and that's okay.
So now that all of Zoe's preoperative blood work has been approved and she's had her preoperative exam, we have placed her IV catheter. We've anesthetized her after pre-medicating her, and what that does is it helps reduce the amount of anesthesia we have to use and gives better pain control. Now what we're moving on to, we've intubated her and we have her hooked up to IV fluid therapy. That's going to help support her cardiovascular system. And if you look here, you can see that she's hooked up to veterinary specific monitors, and that's going to help us to monitor her heart rate, blood pressure, respiration rate, blood oxygen saturation levels, CO2 output, everything that they do for you and I, but on a veterinary scale or veterinary specific equipment. She's also going to be monitored manually by myself or another licensed technician. So for the mass in particular, it's been blocked with a local anesthetic, so she'll be numb there for about 24 hours. And when she's in recovery, that'll work to her benefit for the next couple of days, actually. And as soon as we finish prepping her, Dr. Nix will be in to make her surgical incision, do the surgery, remove the lump, and move her to recovery.
So Zoe's had her surgery, she's recovered nicely. We have applied a bandage because she is the type of dog that would tend to scratch you to stitches. So now we just wait for a pathology report and see if we are done or if we have to do anything else for this cancer. So good luck, Zoe.